Specifically for lung carcinoid, there are several tests that would be best to have before surgery. Obviously, a good cross-sectional image, such as a CT scan, would be very good because then you can see the lesion in the lung, and also it allows you to scan other parts of the body, because just because you may have a carcinoid in the lung doesn't mean it hasn't spread to other places, such as the liver or the bones or other lymph nodes. So CTs are usually a very good place to start. I also advocate getting something called an octria scan. An octria scan is a nuclear test which is very specific for neuroendocrine tumors. And it's usually better to have the test done while the tumor is in place rather than waiting until after it's gone and not really knowing what the results mean. And then of course there are tests, extra tests that we can do, such as blood tests, not only to see how fit you are, but markers, the most common one being chromogranin A. And then there's some other specialty tests too. If you're concerned about bone metastases, you may want to get a bone scan. If you're worried about liver tumors, you may want to get an MRI of the liver. So it really depends on the situation and trying to get as much information as possible at the beginning. One other test that might be valuable is something called an FDG PET scan, because sometimes lung carcinoids are positive on those scans. And a new generation of nuclear scanning called the gallium-68 scan is also very useful as well. Both these tests take a look at your whole body to see how much disease there is.